Well, Mrs. Upton, I see that you've left our favorite 2-year-old at home today. And how's he doing?
Oh, he's like every other 2-year-old you've delivered. He runs around and says no a lot. Are you sure you wouldn't want to take care of him? His daycare seems ready to give up on him.
Well, with a new baby on the way, I'll bet that you're going to find out that he's actually more of a help than what you think. Are you going to continue working after the new baby arrives?
Barring major complications, I don't see any reason not to continue. The daycare is willing to accept infants, and my husband and I really both need our incomes. Do you think I'll be able to continue working? I mean, I'd like to know what to expect with this pregnancy and baby.
I know that you want to have a healthy and safe pregnancy, and I'm going to do my best to provide that for you to the best of my ability. Which reminds me of a question that I want to ask you. On your next visit, we're going to offer you a test called a quad screening. And what this does, it tests for chromosomal abnormalities and neural tube defects that can sometimes complicate a normal pregnancy. Do you remember me discussing this with you during your first pregnancy?
I'm not sure of all the details. Can we talk about it again?
The chromosomal conditions that it tests for include Down syndrome, which is the most common condition, and also trisomy 18, which is a more rare condition, but unfortunately it's fatal to children under 2 years of age. It also tests for neural tube defects, which means that the spine hasn't closed properly.
You only mentioned 3 conditions. Why is it called a quad screen?
We use that name because it uses and tests 4 proteins that's found in the blood, and that can estimate your risk.
So it will tell me if my baby has one of these conditions?
Well, because it's a screening test, it doesn't give us a definitive answer. What it does, though, it can tell us whether your baby has an increase for one of these conditions. It can, for example, indicate that you have an increased risk and your baby be born without Down syndrome or any other problem. And then again, it may show that you have no risk and your baby be born with a problem like that. But in order to get a definitive answer, you'll want to undergo a more invasive test called an amniocentesis. This, however, with the quad screen, medically it will not harm you or your infant, but the amniocentesis does have a chance, 1 in 250 to 300, of losing the pregnancy.
Well, if this screening test is not very accurate, why do people do it?